A patient with previous history of TB now complains of hemoptysis, and what is the important feature that you are able to see? So, any past history of TB can lead to cavity disease, and TB itself can lead to development of Rasmussen's aneurysm, which can undergo the bleeding. Second possibility is, actually if you look more clearly into the radiograph, there is an air crescent sign with a fungal ball. That's the reason it is a case of aspergilloma is what need to be remembered. 35-year-old with a fever, cough and sore throat, and ECG is showing ST segment elevation, but it is diffusely present. Diffusely present ST segment elevation. Such a diffuse ST segment elevation along with the fever suggests you of myocarditis, and myocarditis is caused by Coxsackie B virus is what you need to remember. A child has developed rash, and what is the etiological factor for this rash? So it's called slapped cheek appearance, which is typically seen with the human parvovirus is what need to be remembered. A 60-year-old with a gritty sensation in her eyes and a dry mouth and difficulty to speak, no other medications, and clinical examination is shown. So there is a dry tongue, dental caries, bilateral salivary gland enlargement. So all these are typically suggestive of Sjogren's syndrome. So you have to do Schremer's test. Schremer's is, you see how the lacrimation is happening, and absence of lacrimation is an important feature. 20-year-old with a low back pain, improved on exercise, and there is a loss of mobility in the lumbar flexion along with a kyphotic posture. And what do you see? A bamboo spine along with the sacroiliitis. So it is a typical case of ankylosing spondylitis and a spondyloarthropathy. So seronegative spondyloarthropathies are a group of disorders. Why they are called seronegative? Because they are rheumatoid factor negative, right? Ankylosing spondylitis typically involves the axial skeleton instead of appendicular skeleton predominantly, so hence called spondyloarthropathy. A 20-year-old has got arthritis and history of burning micturition, joint effusion is there, and sarcinate balanitis and keratoderma blemerhagica, which are all the classical things that are typically seen in the case of the Rhetus disease. And the precipitating factor can be either a non-gonococcal infection or infection in the GI tract is the precipitating factor, like Campylobacter jejuni or Yersinia enterocolitis can lead to development of the Rhetus disease. 65-year-old male with a sudden onset of severe knee pain, the knee is red, swollen and tender, and he has got history of diabetes and cardiomyopathy. And the knee joint, what is it showing? It is typically showing a calcified line, which is typically a feature of pseudo gout, where there is a chondrocalcinosis. Can you appreciate the typical calcified cartilage? So you need to do arthrocentesis, and birefringent, positively birefringent rhomboid crystals are the typical calcium crystals which you see in the case of the pseudo gout is what you need to basically remember. A elderly patient has got an ESR of 105 with the pain in the hands and shoulders. There is a transient blindness along with unilateral headache. If giant cell arthritis is one end of the spectrum, the other end of the spectrum of the disease is polymyalgia rheumatica. So what he is having is polymyalgia rheumatica. So they will also have jaw claudication, shoulder pain, high ESR, just like giant cell arthritis. Just like giant cell arthritis, where there is a bleeding that can happen due to vasculitis into the ophthalmic artery, even that can happen with polymyalgia rheumatica, and they are at the risk of developing blindness is what need to be remembered. A young patient He is having swelling of the leg, also painful genital ulcers, no urethritis or conjunctivitis. What is your diagnosis? So he is having aphthous ulcer, and he is also having thrombophlebitis. So what condition can explain all these clinical features together? Behcet syndrome. So Behcet syndrome is a multisystem disorder where you have recurrent oral and genital ulcers, superficial and deep vein thrombophlebitis, iritis, uveitis, non-deforming arthritis, etc., etc. A 19-year-old has got a low back, morning stiffness, and he has got a murmur. What type of murmur it is? Between S2 and S1 you call diastole. Early diastolic murmur is there, which is typical of aortic regurgitation. So aortic regurgitation along with the rheumatological combination, low back pain, where do you get? Typically, and also he has got uveitis. So typically in ankylosing spondylitis, people also have aortic regurgitation along with uveitis as the extra articular manifestations of ankylosing spondylitis. A patient has glomerulonephritis along with ulceration involving the palate. Palate is a part of the upper respiratory tract. Along with that there is a cavitating lesion which is the lower respiratory tract. Along with that he has got glomerulonephritis. URI, LRI, glomerulonephritis, the combination is a typical feature which you see in vaginous granulomatosis. Now, in an elderly patient who has undergone vascular catheterization, typical history of catheterization is there, angiogram. After that, there is a development of necrotic lesions that has happened. Elderly people have atherosclerosis. When significant atherosclerosis is there, you are muddling with the vessels while doing catheterization. Cholesterol emboli can form. They can go and occlude, and that can lead to development of multiple cholesterol embolization syndrome is what you have to basically remember. In a 58-year-old who has history of fever, weight loss, scalp pain, headache and visual changes, what is your diagnosis? Classical of giant cell arthritis. A 15-year-old hypertensive Asian girl, pulseless disease. Whenever hypertension is below the age group of 35 or above the age group of 60, you should suspect secondary hypertension as an underlying cause is what you have to basically remember. And there is also a dilatation of the aorta. So this is classical of Takayasu arthritis, which is aortoarthritis, is what you need to basically understand. 22-year-old pregnant woman had a road traffic accident. She is conscious and communicating verbally but becoming increasingly breathless. And her oxygen saturation is about 89% and her pressures are 100/60. And radiograph is showing tension pneumothorax. So completely loosened hemithorax, tracheal deviation is there, right, along with a mediastinal shift. So what you need to do is you need to immediately do a chest tube insertion and then drain the air out is considered to be management of choice. Satyaraju is a 35-year-old contractor from Kakinada, and he presents with audible wheeze. Blood pressure is low. So what is the best management of this anaphylactic state? You have to give intravenous adrenaline is the management of anaphylactic shock is what you need to basically remember. 73-year-old and her routine blood test shows hemoglobin low and mean corpuscular volume low. So what is the differential diagnosis of a low MCV, doctor? Thalassemia, sideroblastic anemia, etc., etc. So she has got lethargy and malaise, and she is on an antiplatelet like clopidogrel. So that makes it more favorable to become a diagnosis of blood loss associated iron deficiency. A obese 61-year-old is having pH of 7.37 and a low PaO2 and a high PaCO2, which is a sign of respiratory failure. And he improves with nasal ventilation. So that clearly shows it is a obstructive sleep apnea, Pickwickian syndrome. Now, 51-year-old with increasing abdominal swelling and grossly elevated CA-125 and ascitic fluid is showing malignant cells, which is typical of ovarian carcinoma. Adenocarcinoma cells are seen in the ascitic fluid. A 49-year-old with increased exertional dyspnea and swelling, and on examination she has star-stained fingers in the right hand, JVP is elevated, Kusumal is negative, and apex beat is grossly displaced into posterior axillary line. There is a pansystolic murmur and his ECG is being shown. First, when you see ECG, look at the rhythm and axis. Lead 1 is looking up, lead 3 is looking down. So what is the axis deviation? Left axis deviation. If the lead 1 is looking down, lead 3 is looking up, they are right towards each other, right axis deviation. So what you have here is a left axis deviation. And if you look at the lead V1, V2, V3, deep Q waves are there, which are suggestive of ischemia. So typically what the patient is having is ischemic cardiomyopathy is what you have to basically understand. 64-year-old, right-sided weakness, 3 to 4 day history of worsening headache, and on examination has right hemiparesis and CT shows a strip of the bleed, elderly person without history of trauma, with no lucid interval, presenting like dementia. That is all suggestive of a venous bleeding, which is a subdural hematoma, is what you have to basically remember. 83-year-old is admitted with severe community acquired pneumonia and is found to have a hemoglobin of 7.9 but MCV 102, and the blood film is showing significant reticulocytosis. A significant brisk reticulocytosis is indicative of hemolytic anemia. So which pneumonia is known to lead to typically mycoplasma associated pneumonias or autoimmune hemolytic anemias? So Coombs positive hemolytic anemia can occur in mycoplasma pneumonia is what you need to appreciate. 22-year-old hypopigmented patches on the dorsum of her hands, presented with weight loss, loose stools, oligomenorrhea, and her examination of the fingers, what are you seeing? Onycholysis. So typically onycholysis is a feature of hyperthyroidism in addition to many other conditions which can lead. Then hypopigmentation typically along with vitiligo is a feature of autoimmune conditions like the Edison. And the Graves' disease patients will have pseudo clubbing, ophthalmopathy and tibial myxedema. So these are all the classical telltale signs of the systemic telltale signs of a internal disease. Now, a previously healthy 25-year-old music teacher develops fever and rash. 1 week later, she complains of cough and there is an infiltrate on the X-ray. Then what is the most likely etiology? So, this is pneumonia along with skin rash, right? Should make you to think of varicella pneumonia. Varicella is a chicken pox which came back, right? Then 22-year-old with fever, shortness of breath, no pleuritic pain, and a chest radiography showing bilateral hilar infiltrates. And silver methylamine stain is showing typical lid-like cysts, which are classical of pneumocystis carnii. And most of the times, history provides a clue. What is the history? There will be significant respiratory distress along with pneumonia, but there is no sputum production, unlike in case of bacterial pneumonias. In bacterial pneumonias, you have respiratory distress along with sputum. Then cavity formation, pleural effusions, they are all the features which are seen in bacterial pneumonias, and they are against the diagnosis of pneumocystis carinii, because pneumocystis is fundamentally a interstitial pathology is what you need to remember. A 19-year-old, athlete's foot, sudden onset of fever, pain in the right foot and leg. And there is a tender inguinal lymphadenopathy, and the physical examination is typically showing thrombophlebitis. So it is most likely to be streptococcus pyogenes associated erysipelas is a cellulitis which you are seeing, which is caused by streptococcus pyogenes is what you need to understand. A HIV positive develops fever and dysphagia. Endoscopy is being done. So you are finding the hyphae, which is very typical of Candida albicans infection, yeast and hyphae. 50-year-old has got a sudden onset of bizarre behavior. CSF shows 80 lymphocytes. MRI is being shown to you, which is showing the temporal lobe involvement. So temporal lobe involvement is a very classical feature of the encephalitis caused by the herpes simplex. So above the umbilicus, herpes is all HSV type 1. Below the umbilicus, all genital infections, everything is all HSV type 2 is what you have to fundamentally remember. A 36-year-old underwent operation for a perforated appendix. She has vomiting, so post-operatively, and air fluid level centrally located, which is suggestive of small bowel obstruction, which is not uncommon because of the post-operative adhesions. A 50-year-old with chest pain with regurgitation for solids and liquids and a rat tail-like appearance of achalasia cardia is what you are able to classically see. A 69-year-old woman with long history of dyspepsia, and there is a sticking point and there is a microcytic anemia. So classically is a case of esophageal constriction. Esophageal stricture is what you are able to see, which makes the person feel like food is sticking, doctor, is the classical history. A 41-year-old with 3-month history of epigastric pain and dyspepsia. Upper GI endoscopy shows multiple gastric ulcers. So which is very classical of Zollinger-Ellison syndrome, refractory multiple duodenal peptic ulcerations is a classical feature of Zollinger-Ellison syndrome. 22-year-old, 4th pregnancy, during labor, pulse is 98, complaining of abdominal pain, and typically there is a retroplacental hemorrhage is what you are able to see, which is a sign of abruptio. So at that time what you need to look is for the assessment of the fetal well-being. The fetal heart sounds are the ones which you need to basically assess. 27-year-old induced at 37 weeks of gestation for preeclampsia. She requests pain relief and epidural is being given and her BP has fallen down. So whenever epidural lead to fall of BP, nothing to worry, phenylephrine is considered to be one of the important things that you need to initiate emergently as the best treatment. Hypotension after epidural anesthesia. A 26-year-old at 18 weeks of gestation has shown hepatitis B positive, but her envelope antigen is negative. That means she has got a low infectivity but hepatitis B positivity. So in that scenario, what is the best way to manage? In such low infectivity cases, neonatal hepatitis B vaccine is the one which is the most recommended option. 28-year-old female in her first pregnancy admitted at 37 weeks of gestation. LFT shows elevated alkaline phosphatase and a bilirubin is 20 and she is having 3 contractions, and vaginal examination shows cervix 5 cm dilated and there is a meconium stained liquor. So what she is having, the clinical problem is called obstetric cholestasis. So whenever obstetric cholestasis is there, it is an indication to do continuous topography during the labor. 22-year-old primiparous woman, 20 weeks of gestation, and uterus is non-tender and there is a suprapubic tenderness with bilateral flank tenderness. So whenever urinary tract infection, pyelonephritis is there during pregnancy, One of the important things that need to be done is a bladder catheterization is considered to be the most important thing and initiate the antibiotic treatment. 30-year-old with Crohn's with multiple fistulae around the anus. So perianal fistulae in Crohn's disease. Sepsis anywhere, drainage is considered to be the primary management. Patient is having pain in the back, lack of interest, low mood, lethargy, decreased sleep, etc., etc. 50-year-old. So he is not taking NEET PG. So how do you want to manage? SSRIs like sertraline is the one which is indicated. Whereas olanzapine and haloperidol mentioned are all antipsychotics. For depression in a Tollywood actor from the Anakapalli who is going to get married. After married he has got a constitutional duty to perform on the bed. So if you give any other drug which is leading to impotence, right? So at least he may not be getting good orders in Tollywood. He will be failing in the home also. So that is the reason you should give such a drug which does not have impotence as a side effect. So bupropion is least potential for causing sexual dysfunction. So what provokes anxiety? All this will provoke anxiety but not clonidine, right? But not clonidine. So flumazenil being anti-benzodiazepine can provoke anxiety, LSD can provoke, isopronolol can provoke, etc., etc. Infantile autism by definition will have an onset before the age of 3 years. You go to AIMS, PGI, nowadays no more state entrance. Any exam, this is the favorite question of the examiner. A 30-year-old with cough and increasing shortness of breath, symmetrical hilar masses which are lobulated, well defined with peripheral calcification. So that is classically suggestive of teratoma. What are the 4 anteromediastinal tumors? Teratoma, thymoma, terrible lymphoma and retrosternal thyroid. These are all anteromediastinal masses. 57-year-old underwent palliative chemotherapy and increasing cough and breathlessness. Reticulonodular interstitial opacification is there. Left lung is clear but a bright pleural effusion is there. What is your diagnosis? So whenever there is a septal thickening, that is highly suggestive of lymphangitis carcinomatosa is what need to be remembered. 80-year-old has got cupping and fraying. Then what is the most specific radiological feature which is seen in case of vitamin D deficiency? Presence of costochondral expansion is considered to be a very specific thing about the rickets. 30-year-old man is admitted to the hospital with chest pain and the chest radiograph demonstrates sclerosis of both the humeral heads and there are pulmonary infiltrates and what is an important imaging feature that you are supposed to see? So classical of sickle cell disease, head-shaped vertebrae are the classical feature in case of sickle cell disease. In hepatocellular carcinoma, from where does the HCC derives its blood supply? Predominantly from the hepatic artery, it gets the blood supply. Now what is a vocal cords and lining, histological lining? So typically the lingual surface of the epiglottis and the true vocal cords, they are lined by stratified squamous epithelium. The remaining of the larynx is typically by the ciliated columnar respiratory type of epithelium. The primitive streak typically forms at around 15th day of development. Now I think you are going to have tough time with anatomy, physiology, biochem, micropharma. Earlier days 5 marks, happy life. But don't worry because it's anyway you all know that those who are good in these basic sciences are automatically good in medicine surgery. So pharmacology is not a challenge, only anatomy is a big pain. Right? Anatomy to master to such a micro detail that too with a fear that if we don't read, we will join MS Anatomy, is very challenging thing. But yeah, in mature Graafian follicle, the antrum, where does it lie? It lies between membrana granulosa and zona pellucida is what need to be remembered. And this is a typical structure where you have corner radiata, cumulus oophrus, etc., etc. Death sentence can be awarded by only additional sessions judge. So, what are the magisterial powers of each type of the judge? How much punishment they can give? How much monetary punishment, jail sentence? All that I should be sure. Capital punishment is hanging. Not all can hang. So both sessions judge and additional sessions judge can pass the death sentence. I think the remaining questions are all easy, doctor. I think image based questions, most of them are done. So review them, and next week, today is what? 27th. So by next week, still next week is also, there is a send off. अलविदा बोलने के लिए our time है, huh? So please do come once more. On Wednesday we have a test, and Sunday. Following that you have got the NEET PG, and we will know actual examiner how many image based questions, how many case study based, how many single liners. One thing is, there may not be too many image based questions, be quite sure, not more than 10 to 12. Just like DNB. See, it is like writing another DNB. There is no big surprise about NEET PG, which you are all habituated with. How many of you have taken DNB? Yeah. Are there a lot of image based? Max to max 20, that too easily approachable. Looking at their face only, you know what examiner is looking for, right? Then big case studies, not many. Are there many? Not many. Most of the times, once more it is single liner. What is the length of your nose? What is the length of the ear? That kind of questions only, right? And because when you have to create a big question bank and circulate it, it's a big challenge. One single exam, you can create a tight examination with 60 image based and all. But almost all 10 days exam, 3 sessions, 30 exams he has to conduct, means he can't be too good in all exams, right? So that's the reason, yeah. So thanks for your patient listening.